We will present this data as an oral presentation here at EHA, and it is, you know that, now treatment of multiple myeloma, newly diagnosed myeloma, has really been an explosion of new drugs, and particularly of new combinations. The quadruplets have revolutionized this treatment, and also in the non-transplant candidates. This now here in this study, this is a Phase Ib study, the DREAMM-9, that would evaluate a quadruplet combination, substituting the anti-CD13 monoclonal antibody with Belantamab mafodotin with the antibody drug conjugate. So this Bela-VRd for these non-transplant candidate patients. Phase I study, multi-cohort study, and well, we have 118 patients included in different cohorts, as I said, with different starting doses of Belantamab mafodotin, 1.9, 1.4 on 1. And what is more important is different schedules of treatment of Belantamab. Belantamab is given in some cohorts once in every cycle. In the other cohort are given once every 2 cycles, and the other one is once every 3 cycles. So an induction and then also in maintenance. And what we see in these patients with a median age of 74 years is that they have very good responses, with 90% responses, with 50%, more than 50% MRD negativity rate, particularly maybe in those that receive the drug every 6 or 8 weeks, so that is every 2 cycles. They have 1 dose of Belantamab mafodotin, and I think this is very interesting because they have this efficacy. Also, what is very important, it was the primary endpoint of the trial was safety. We know, and it was presented previously, that it's very well tolerated, and here we will also focus on the corneal toxicity, and what we see is the corneal events are really reduced when we skip some doses of Belantamab, and we give it in the induction probably every 2 cycles, every 6 weeks, and then in the maintenance phase, which is from cycle 9 and on, we give Belantamab every 3 cycles. Here we see that we keep the doses, the cumulative doses of Belantamab maintained, also, and we decrease really the dose or the incidence of the corneal adverse events. So I think this is interesting to have these combinations with Bela, and the starting point for new combinations or newer studies evaluating this drug in this newly diagnosed setting.